Hello, I'm Dr. Maurie Markman from City of Hope, and I would like to briefly discuss what I consider to be a very discouraging report, and one which I believe we as an oncology society, quite frankly as a medical community, need to deal with. The title of the manuscript I'm referring to is it's from the United States Department of Health and Human Services, Human Papillomavirus Vaccination Coverage in Children ages 9 to 17, United States, 2022. What this particular analysis looked at was the coverage of both men and women, young boys and young girls, I would say, receiving at least one dose of the recommended HPV vaccination. Since 2006, girls have been recommended to receive HPV vaccination. For boys, 2011. So certainly the time period that we're considering falls within the recommendations based on overwhelmingly positive data. Now, today, still the recommendation is for more than one vaccine given once, so that obviously there may be evidence in the future that a single vaccination may be acceptable or appropriate, but today it's more than one. But in this particular analysis, they were looking at just a single vaccination. The vaccines have targeted young individuals, again, both males and females, age 11 and 12, but it's certainly acceptable to you to look starting at age 9. So what is the bottom line? At least one dose of the HPV vaccination, 2022, 38.6% of children aged 9 to 17. We are talking about a cancer preventive vaccine, which is on the basis of population-based data in the United States, but also in other countries, is incredibly effective to prevent HPV-associated cancers, which not only occurs cervical cancer, it also includes a large percentage of head and neck cancers. This vaccine, which is incredibly safe, incredibly effective, in this country, only 38.6 have received even a single dose. It is noted that the individuals with private insurance, their rate is higher, 41.5%. An individual with no insurance, it's only 20.7%. In my opinion, this is clearly a failure of our public health establishment at all levels. The risk of cancer, and my own focus has been in gynecologic malignancies. I've seen young women with cervix cancer, advanced cervix cancer. This is a disease we can prevent, and yet this is where we are. For those of you who are interested in cancer prevention, public health, I think this is a very sobering statistic. And somehow as a society, it's my plea, it's my hope, we can do something about it. I thank you for listening, and I would encourage you to think about this question if you're in this area.